Good evening, everybody. The chairman of the Presidential Task Force on COVID-19 response and Secretary to the Government of the Federation, honorable ministers, national coordinator, permanent secretaries and directors, and ladies and gentlemen of the press. Nigeria has, as at today, crossed the 50,000 landmark and recorded 50,488 COVID-19 cases. This is out of 366,244 samples tested so far, of which 37 persons among those recorded as positive have been successfully treated and discharged. We have sadly had 985 fatalities, which is also a reminder to all of us that COVID-19 has not abated. The male to female ratio remains at 2:1, with more infections in the age group below 50 years, but more fatalities in the higher age bracket, and also among the vulnerable and those with fragile health conditions. The changing dynamics of the virus and the disease make it necessary for us to continue to review our response strategies, and we ensure we train and update our health workers on the latest and most effective approaches to treatment of COVID-19 and tailor our procurement also in the light of knowledge gained. We have said before that we pay more emphasis and attention to oxygen concentrators now than to ventilators. The Department of Hospital Services of the Federal Ministry of Health leads the effort for training and retraining, and we are also training intensive care experts in case we need them for intensive care stations, and also general training to improve the pool of experts and focal persons in various specialties, particularly with the strategy of training trainers and in infection prevention and control at all service levels and in all health facilities. The information session on COVID-19, which is conducted weekly by the World Health Organization, was held this morning, and I had the opportunity of sharing Nigeria's experience as one of 2 countries who were invited to make presentations on our response strategies. A clear message from this briefing is that COVID-19 is a threat to mankind, and there is need for all countries to work together for solutions that will allow equitable access to information and also on therapeutics and vaccines. In the words of the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, by working together, we are protecting each other, and in a global pandemic, none of us is safe until all of us are safe. Nigeria is also working with the World Health Organization to finalize enrollment and participation with the ACT, Access to COVID-19 Tools Accelerator, a global mechanism tracking and sponsoring research organizations working on COVID-19 vaccine development, and also have interest in the COVAX facility, which is a Gavi-supported global initiative to procure and assure equitable access to vaccines as soon as they are available, especially for lower and lower middle income countries. This will prioritize Nigeria for allocation of a part of 2 billion vaccine doses that will be secured in a special plan to protect the interests of poorer countries. I shall end by reminding all of us to take responsibility together, not only for today, but for the days ahead, when the imperative to open our economy and also to allow people to make normal livelihoods will demand great sacrifice and discipline from all of us. The new normal, to compensate the effect of allowing free travel and commerce, will be demanding for all of us, but we all, government and citizens, must collaborate to halt the spread of this disease for each other's sake. Global experience so far has proved that by following advisories and adhering to prescribed measures, including appropriate wearing of masks, physical distancing, respiratory hygiene, we can control the spread of this disease and mitigate its effects. The health sector on its part is continuing to strengthen itself as we develop new coping measures to counter the challenges that we can see coming ahead, from developing ambulance transport systems for patient transportation to improving treatment and case-finding options. Thank you all for your attention.